to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. If you're just joining us, we are talking about dermatological diseases. Express Care's Dr. Jitka Lom and two visiting doctors from St. Luke's Medical Center were recently discussing this topic at a Let's Talk forum. Doc, let's get to our viewer questions now. Will my child ever grow out of her eczema?
Oh, that's a fantastic question. Your child will always have the tendency to have dry skin. But as you get older, first of all, you can probably tolerate your exposure to chemicals a little bit better. You're less sensitive as you get older, so you may be a little bit better off, hopefully. Some kids do grow out of their eczema and then grow back into it as they get older, you know, in their later years as our skin again gets drier. Will it ever be perfect? Probably not. They'll probably always have sensitive skin, and they should avoid products with a lot of fragrance and chemicals.
Okay, the next question says, my mother has psoriasis. Does this mean there's a chance I could develop it?
Definitely, yeah. Psoriasis does run in families, along with obesity and high blood pressure and diabetes. These are sort of going together, especially the obesity part. But psoriasis does run in families. You have a higher risk, and all you can do is take care of your health as best you can, stay fit and healthy, eat right, get lots of rest, and minimize your stress.
Okay, our next question says, being active in sports, what are some steps I can do to take to prevent athlete's foot? We don't really talk about this one too much.
Yeah, that's a great question. Athlete's foot, so that's an infection between your toes. Sometimes it'll also affect underneath, but mostly between the toes, and the skin gets kind of mushy and white. And changing your socks frequently and changing your shoes, and then putting some baking soda in the shoes overnight, maybe rotating a couple of sneakers, so one day you let the other sneaker dry. If you wash your shoes, throw them in the dryer so that you get all that fungus. If you heat it up, it'll die. And then lots of times foot fungus or athlete's foot is actually not a fungal infection. So people try every over-the-counter antifungal there is, Lamisil and Tinactin and all that stuff, and it doesn't work between the two baby toe and the fourth toe especially, because it's actually bacterial, especially if there's an odor. If you go down there and smell it and there's a little odor, it's often bacterial. So if you've tried a whole bunch of antifungals and it's not working, switch to an antibiotic ointment or cream for a few days and see if that'll help you first. If not, come to the clinic and we'll fix it.
All right. That's interesting.
Yeah.
All right, a few months back I had a boil on my neck, and now I have another boil in the same spot. This person asks, is this common?
Yes, it is common, and now you understand why, because boils are a staph infection. So that boil was there in your neck, it went away, let's say, or it resorbed or whatever, but some residual bacteria were there. Plus you're a carrier, you carry it in your nostrils probably, almost certainly. And when you sleep at night and you go on your pillow and so on, some of those germs will go onto your pillow, they'll go onto the rest of your skin, or if you're just touching your nose and then touching your neck, that's all it takes sometimes. So when we take care of boils, we don't just take care of the one boil, we take care of the source, which is in your nostrils, and we teach you to wash your nose and put antibiotic ointment up your nose to clean it and get rid of that, and also to use the body wash called HibaCleanse, like we mentioned, to try to fumigate the body and not have germs on it. And using hot water and soap is really important.
Okay, good to know. The next question says, I never had acne as a teenager. Why am I getting acne now as an adult? And I've heard this by so many people.
Yeah, that is sad. So acne, is related to so many factors. One of them is hormones. That's when it usually affects the teenagers, but it can affect adults, especially women in their higher years. Oil. Again, the amount of oil that you have on your face, which can be related to climate, and then also it can be related to products that you're using. So many times women in their 20s and 30s are wearing a lot of makeup, using different products that can actually be causing some of your acne. So there are many different factors that might be aggravating it, and stress definitely will bring on acne. Before your period, you may get your acne. These are things that are very common, but again, very treatable and controllable. Acne isn't really a condition that we ever cure permanently usually either. It's something that we deal with, it's much better, and over your lifetime, once in a while, you may get some problems.
And what do you think is the best thing to treat it?
Well, we use, first to clean the skin, okay, so we use a mild facial cleanser like Cetaphil or Dove soap, something very mild to wash the face with. We don't want to use harsh stuff. You do not need cleanser, toner, you do not need toner, okay? Most of the time that is really not necessary. Just wash your face with Cetaphil or Dove soap. Then we use, the simplest thing that you can buy over the counter is something called benzoyl peroxide. The trade name is Clearasil, something like that. Just the 5% gel or cream, and you can apply that twice a day to the entire face where you have acne. And you need to be patient because this takes about a month to 6 weeks to start even getting better, you know, a little bit. It takes time. So if you're patient and after 4 to 6 weeks there's a little bit of improvement, keep going. If not, then you really need oral medication. And we use medicines such as antibiotics. Sometimes we'll use birth control pills to regulate the environment and make the hormones more even. We use other medications to help you destroy oil that are a topical prescription. So these are all different tools we have. We have so many different tools to help acne, knowing that maintenance is going to be necessary.
All right, Doc, thank you so much.
Sure.
And I know we threw a curveball at you with all these varied topics today, but thanks so much.
Sure.
Doc will be back again next week when